Can't wait to hear from you. This is a monumental day, not just in Indiana, but for this great nation, because 9 executive orders addressing MAHA initiatives, I think breaks the record. Secretary Kennedy, is that right? By far. And I want to thank Governor Braun and his staff for so thoughtfully crafting these in support of President Trump and Secretary Kennedy's commitment to the American people that we will make this great nation healthy again. Now, let me give a little bit of background on why I think this is so important. And it all starts with the word subsidiarity. How many of you know what that word means? It's actually a fair number of Catholics hear that. Subsidiarity means you push the decision to the person lowest on the totem pole who can make it correctly. It's the most efficient way to run organizations in general. And in subsidiarity, you don't want the federal government making decisions about lifestyle issues if the state can do it, because the governor is capable, he knows his people. And you can go down the path because the most important person in the entire hierarchy is the mom, because she knows you'll win the battle for health in the home, in the kitchen, the living room, the bedroom. That's where the real battle for health will be won. And these executive orders make it easy for moms to do the right thing for their kids. Now, my position as administrator of CMS is helping to ensure that the nation's health insurance programs create the right incentives, empower the right people, including especially patients, so they now feel like they own a piece of the rock, like they matter, like they have agency over their future. And we want to make sure that we allow all Americans to be able to appreciate how important these lifestyle changes are. And to do that, I'm going to do what doctors are sometimes forced to do, which is to give you some news you might not want to hear. But once you know it, we've got good news to follow. First bit, the #1 line item in the state of Indiana, as it is in almost every state, is Medicaid. That's not actually the most important number, because there's a lot of other things you spend money on, but it's the fastest growing as well. And that's the part that's most concerning, because this is a commitment we have made to our most vulnerable. And if it's doubling, as it has, I am told, in the last 4 years, then it's not a sustainable program. It's one that desperately needs to be saved and strengthened. To do that, we have to deal with another big reality, which is that the healthcare expenses in this country are increasing at 2 to 3 times faster than the economy. Effectively, we have now generated a healthcare system that has a country attached to it. And that's not healthy long-term. If we're spending twice as much as any other country and not getting the life expectancy benefits that we anticipate, and 30 years ago, we were about equal to Europe. Now we're about 5 years behind Europe. We're going in the wrong direction. We're not getting value for the money we're putting into it. Why? Chronic illness. It drives 70% of the total healthcare budget. And the kinds of things that are in these executive orders will help reduce that incidence of chronic disease, because it turns out that about the most patriotic thing you can do these days is to get healthy. It will dramatically allow our nation to be as healthy as it can be, and it feels a heck of a lot better to be healthy than the alternatives. So how are we going to do this? I wrote down 3 ideas that came out of the executive orders. The first is walking. Little stat to come in handy at dinner tonight. If every American walked 20 minutes, exercised 20 minutes a day, broke a little sweat, it would probably reduce our healthcare budget, the part that I'm especially worried about at CMS, by about $100 billion. These aren't small rounding errors. These are massive ways of addressing the challenges that we face. The President's Council on Sports, Fitness, and Nutrition that I was honored to be a part of in the first Trump administration, actually created by Secretary Kennedy's uncle, John F. Kennedy, is a good example of how we can do this well. I learned on that committee that the #1 thing we often lack in communities are coaches. It's an action step. We should make it easier to mentor young people. I'll come back to that theme. Second big topic, nutrition. Quite a few of these executive orders touch on that reality. I'll give you a little tip that I learned years of studying nutrition science. It turns out that the most healthiest way to address food is to eat food that looks the way it looks coming out of the ground. That's like a simple way of memorizing what makes sense. That's why butter is better than hydrogenated oils, because it doesn't matter if butter might cause other issues. It's real food. Your body knows what to do with it. It's a home game. So we need to get everyone to understand the power of food. And to do that, we need to get parents and teachers and physicians and other health providers to understand it as well. The executive order that insists that to get credentialed, you have to learn nutrition if you're a doctor is critical. When I was in medical school, there was no nutrition class. I actually ran for student body president and won on that campaign promise, and we started one. Today in America, most medical schools do not teach nutrition. Why does that matter? Because if you go to 4 years of medical school and bust your tail and learn everything, and nutrition wasn't on the docket, what is that message to you? It doesn't matter. It's not important. If it was critical, you would have been taught it, because you learned everything else you needed to learn in medical school. If nutrition is not on the agenda, not in the syllabus, it's not really important for you. And I believe that we should empower folks, and the executive orders will do just that, to be able to navigate nutrition, and we have plans at CMS to make that easier. Finally, community involvement. The number one driver of an expensive patient is a patient without another person in their life. I'll say that again. Loneliness ends up driving a lot of the pathology that we then have to deal with in the healthcare system. The way you deal with that is by having community groups that work together well. One of the executive orders encourages schools to get young people to become educated about health, but I'll tell you from personal experience, they also become activists in a good way when they're healthy. We started a foundation with my wife 20 years ago and have done very well across the country, touching the lives of millions of young people doing just this. And when I go into these schools, as I hope many of you will, and you look at the eyes of these young people, sometimes it looks like the light's gone out. They just want to have a belief that they matter. And so after having done this a lot, I'm confident this executive order will make a difference, because it'll get young people to believe they have agency over their future. And if they do that, if they have mentoring programs that support them, that are out there, then we'll have a unique ability to allow this system to spread like wildfire, because young people want to be connected, they want to be in community, and they're right now being atomized and ostracized. Now, our nation is too great for small ideas. And the ideas that Secretary Kennedy and President Trump are putting forth in rapid fire, and now supported at this level of intensity in the state of Indiana, are emblematic of the fact that we have a generational opportunity to make this country as healthy as it should be. And the person who has represented this more than any other, Secretary Kennedy, is a dear friend. I've known him for many years through his foundation work, but I met him on my show. And when he came on the show, many did not want him to appear because they thought he had far-out ideas that were so bad they shouldn't be heard. And I'll tell you in my mind how you define MAHA, because it's how you define the next speaker, Secretary Kennedy. It's defined in 3 words. The first is curiosity. Are you truly desirous of learning what needs to be done to improve the life of your fellow man? And if you are truly curious, and remember 80% of questions are statements in disguise. So if you're truly curious and you really go in there with questions and you hear stuff that matters, are you then courageous enough to share it with people around you? Because when you do that, sometimes folks get mad at you, especially with the current healthcare system that we have. And certainly Senator Kennedy has faced that. Secretary Kennedy finally is a compassionate man. And I say that because I think of him like a brother, but I have never seen him do something mean to anybody else. So if you're curious and you're courageous and you're compassionate in sharing that wisdom, as difficult it is for people to hear, that makes you a true healer. Secretary Kennedy, thank you.